I'm Dr. Berzin. I'm the founder and CEO of Parsley Health, and at Parsley we are a new alternative to primary care where we focus on nutrition, wellness, and prevention along with cutting-edge medicine. Well, I went to Columbia here in New York City for med school, but I actually went there with the desire to practice medicine in a different way, which made me really different from day one at a place where pretty much everyone wants to be a cardiac surgeon. I had a great time and an incredible education at Columbia, but my inspiration to going to medical school in the first place was rooted in my yoga practice. Right after college, I was working in New York. I found myself 22, typical young New York kid. I was working at the US Attorney's Office prosecuting securities fraud. Can't say that was my calling. And I found myself in a yoga class, and I had studied public health quite a bit in college, and through yoga I recognized that so many people were living themselves sick, and yet medicine really wasn't addressing this. And we know that 86% of our diseases today are chronic and lifestyle driven. And again, I just saw through medicine, my dad's a doctor, primary care doc, I saw that these things just weren't getting addressed, and yet they could solve so many problems, lower costs, and things like yoga, nutrition, meditation, lifestyle change. These things had to be frontline. And that was actually what inspired me to go to med school in the first place. And so when I ended up in med school, it was really with the desire to have the strongest foundation in clinical medicine at the highest level that I possibly could. But I always knew that I wanted to use that foundational training in a little bit of a different way. In conventional medicine training, you spend a couple of hours maybe on nutrition, if at all. And when you talk about nutrition, you're focused on like nutrition for bed-bound patients in the hospital, which is a different type of nutrition. You really don't learn about nutrition for the average person. And so when you go into your primary care training in medical school and in residency, you're focused on pharmacology, you're focused on drugs and referrals to specialists, and you sort of burn and churn people through that process. People come in, you spend 10 or 15 minutes with them, they leave with a referral to a specialist and a prescription for a drug. And I knew from my personal practice of yoga and my self-training in nutrition that was ridiculous. If people stopped drinking Coca-Cola and started eating differently, a lot of these problems that they need blood sugar medications for and blood pressure medications for would go away. And so I wasn't aware when I first started medical school that there was even a way to practice medicine like that. But because I had met Dr. Mark Hyman, who's the chairman and president of the Institute for Functional Medicine, which has trained about 10,000 doctors so far in the US to practice this way, I learned that there was a training in something called functional medicine for people who were already doctors, already trained and licensed physicians, to learn how to practice medicine the way it should be, to practice it differently. And so it was really hard, though, to make that leap, because when I left residency, I then had to train and pay for training and go off to do this additional training in this approach called the functional medicine paradigm, which thankfully the Institute for Functional Medicine offers to physicians. And that was eye-opening, because it was like, wow, you actually can practice this way at a very high level. This is a cutting-edge approach to medical care that's really been institutionalized. And so I met great physicians through that. I trained with the Institute for Functional Medicine, and I also joined a functional practice here in New York City with an amazing physician from whom I learned quite a bunch. And that was my foundation. And yeah, it was hard, and so I had to go off and find it. Right now, what we know is that there's a lot of primary care doctors out there who want to practice this functional approach to health. But it's a huge barrier to go train with the Institute for Functional Medicine, to even know that that exists. And then even more than that, to go find a job after that. So I actually started Parsley Health first and foremost to make this kind of medicine widely available to the general public, because historically it's been available only to very wealthy people. And it's been managed in a way that's sort of old school, and I wanted to modernize it and make it available to everyone. But part of me, this little like interior part of me that has created Parsley, has done it also to create a training ground or a place for other physicians to learn how to do this or to adopt these tools faster, so we can not only help more people at Parsley, but we can, across the space, lower the barrier to entry for doctors to do medicine this way. During medical school and residency, I co-founded a health tech company for healthcare providers and hospitals called Curator. And so I learned a little bit about designing an app that would allow doctors to communicate better with each other. And through that, I got some experience in the tech space of healthcare and health tech. And that was super interesting, because I thought, wow, there's all these amazing new technologies like the iPhone and so forth that are changing our lives out in the world, but they haven't yet penetrated into medicine. And then I was practicing in a functional medicine primary care practice, and I thought, wow, there's such a huge opportunity here to use data and technology to make this care better and smarter, to help it kind of iterate on itself and to make it less expensive so we can have more people have access to it. So all those ideas were swirling around in my mind, and then out of the blue, my husband had a job opportunity with his company to move to Europe for 3 months. And it was one of those things that you just can't say no to. And so I unfortunately had to leave the practice where I was working at the time, but while I was away, I had the opportunity to start Parsley Health. And so we launched a website from our Airbnb in Berlin, and I got on Google Hangouts with prospective members, and I got 40 wild and crazy people to join my practice before it opened so that I could actually open it, and who believed in what I was doing. And those were our founding members. And when I landed, like the day before Christmas, I ran around like a madwoman finding office space, and then launched Parsley the first week in February of that year, which was 2015. And so it all just happened overnight, but I don't necessarily believe in divine intervention, but I do believe in this space having been created for me because of what happened for my husband's work, to have the space to start Parsley, because I don't know if I had just been working day in and day out, if I would ever have had the guts to do it. So at Parsley Health, we include a health coach with every membership. And most people are actually not familiar with what a health coach is, and they're like, why do I need a health coach? And I'm like, well, think of it this way. Even Beyonce has a voice coach. Every top athlete has a coach, right? If you want to perform at the highest level, you need support. And if I, as your doctor, or any of our doctors here, give you a fancy plan, and every Parsley member gets a 7-part plan that includes a nutrition guide, supplements, medications, mental health, exercise, in-depth testing, and a coach. So that's your 7-part plan. The reason that part 7 is a coach is because if I give you 1 through 6 and you do 1 or 0 of those 6 items, you don't get better. And we also don't get data showing that we're actually helping you, which I care about a lot. So it's win-win. So we want to give people support. And so even the people who are the most knowledgeable, they've done the Whole30, they know about gluten-free, they know about healthy fats, they go to spin class 4 times a week. Those people, by and large, still have health issues that can be dramatically improved with this 7-part plan. And so, yeah, it's hard for people. It's hard for people who come and they're like, cheese is my lifeline, and you're going to take cheese away. And I'm like, we're just going to experiment with it. Cheese will be there for you at the end of the tunnel. It is hard for people though to make dietary changes. Oftentimes they get used to them, but at the beginning it's a big shift. It's new for people to sometimes take supplements. It's totally new for people to meditate, even though there's so much literature on how powerful that is. So we give you a health coach to help support you so that you actually make those changes, and that works. We know that that works. And we also see people make little changes 1 at a time. And even if they don't do all 6 parts or 7 parts of the plan, they do maybe 1 part to begin with, you watch their world change. And once they get the hang of 1 part, then it's so much easier to change the other parts. And I think that's where Parsley comes in. And then some people find that even the smallest changes make the biggest difference. When I first started Parsley, or a little while after, I had a 24-year-old woman come to me with a severe autoimmune disease called Behçet's autoimmune vasculitis. And she had ulcers in her mouth going all the way down her GI tract. She had been fired by the top autoimmune doctor at Cornell because his drugs, she had been on every drug, every steroid, and none of them were working. And so I started with her, and I wanted to set expectations. This type of medicine is a process. We don't have quick fixes. It doesn't come overnight. But at minimum, I can help you feel better, because she also had insomnia and weight gain and acne. Her body was inflamed. But she was this also beautiful 24-year-old healthy girl that like no one who saw her walk by would ever assume was so sick. And when she came, we changed her diet. We took out some common antigens or food allergies, including gluten and dairy. We did what's known as a gut healing protocol, which is well documented even at Johns Hopkins and some of the top institutes in the country, to shift the balance of bacteria in her gut. We did some in-depth testing and noted some nutrient deficiencies and some inflammation. And she came back to see me 6 weeks later, and I was kind of nervous when she was coming in, because I was like, she's not going to be better, and this is going to be like so hard, and we're going to have to keep going. I know this medicine works, but it takes time. And she showed up with her mom, and her mom is like crying. I'm going to cry because the story like gets me every time. But her mom was like, thank you for giving my daughter her life back. Ulcers were gone, acne was gone, she's sleeping, weight had already come off. She is 2.5 years later, almost over 2 years later, she's medication free, hasn't needed a rheumatologist, which is an autoimmune doctor. Her inflammation level through a test called hsCRP was extremely high. It took a long time, but it is now in the normal range on no meds. And she knows what to do to make herself healthy. And we still work together, we check her labs, but we not only saved her thousands and thousands and thousands of dollars in medications and so many hours going to doctors that she didn't need to see, we put her in the driver's seat of her health. Well, I think the way that regular people can advocate is to talk to their insurance companies. So we have a system where we've been told that, or taught that we have to spend a lot of money on insurance and hope that we don't need to spend any of that money, or that we don't need to use that insurance. So that's like the dream scenario, right? You spend all this money every year on insurance, and they hope for their bottom line, and you hope so that you don't have to spend more, that you don't use any of it. So we've been sort of hijacked into the system where we have to waste money. And insurance right now only pays for 15 minutes burn insurance primary care. That's what it pays for. It doesn't pay for us to spend an hour with you and get to know you. It doesn't pay for us to understand your entire 360 life story from your childhood to now, how many medications you've taken, what the triggers and modifiers could be to your current health condition. It doesn't pay for more in-depth testing than basic blood work usually. It does pay for the blood work, but it doesn't pay for some of the other tests. And so that sucks. So then you have to spend all this money on insurance, not use it, and then pay yourself for this approach to care. And so when we explain to people what we do and that, yes, you can get reimbursed out of network for it. So a lot of people get reimbursed for our care, even up to 70%. They can use FSA and HSA, all of that's great. But that we can't bill insurance directly the way that we would like to, because the care that we offer and the dramatic results that we show aren't even recognized by our current system. They're all kind of like, WTF, which makes sense, because shouldn't insurance be paying for the stuff that's going to keep us all healthy instead of only paying for things like drugs and hospitalizations? Now, health insurance is amazing. We need it, certainly, to pay for drugs and hospitalizations, but we could universally be saving money and have a better system and this is how Parsley will ultimately reach everyone, and that's my true hope one day, is that the insurance companies understand that they need to pay for time and value, and this approach not to pay for volume, which is what they do now. And so I think where we can all advocate is, one, join practices like Parsley or work with them, because you're going to get so much benefit and you're personally going to save so much money in your lifetime that you're going to make all that money back in the drugs that you avoid and the pain that you avoid and the specialists that you avoid. But where you can advocate is demand from insurance companies, make them hear your voice that you want them to pay for this kind of care, so that those dollars that you spend actually support you in doing the right things for your health and wellness. How long will it take for this approach to be the standard of care? Right now it takes about 17 years for new information to work its way into medical school training. That's like the average. Really sad that it's that slow. And my hope is that we can accelerate that and simply show through example that other institutions, some of the more forward-thinking institutions across the country, and they're out there. The Cleveland Clinic has invested $60 million in a functional medicine center that's lowering overall cost of care. Kaiser and Stanford and other more forward-looking medical institutions across the country really want to change, and they don't know how. I mean, we will win where we not only can help so many people, but where we help others transform. And I think we could see insurance paying for this care in the next few years easily, because they're already understanding that they have to innovate in order to survive. I think that getting it into medical training, I don't know. Maybe we can beat that 17-year mark and get it closer to 10. I think the ideal scenario is where doctors receive training in the specific nutrition protocols that are effective, such as the autoimmune paleo diet, which dramatically helped resolve, my patient's severe autoimmune disease. Ketogenic diet, which I'm actually experimenting with right now, which has incredible promise, not only for resolving weight gain, diabetes, but also even cancer, right? even just removing common food allergens, what be they gluten or dairy or nightshades, I think doctors being trained in these diets as protocols will really go a long way. And when a doctor prescribes you a nutrition protocol, it carries more weight, right? And so I think that's really valuable. But then the day-to-day, what do I cook today? What do I have for lunch? What do I eat when I travel? What the hell is gluten and what's it in? All of that is really served when a health coach who's trained in this approach to nutrition, but also trained in behavioral change and support, educates and works with that patient, whether it's one-on-one or in a group setting. So for some people, the one-on-one is great. For others, at Parsley, we do community events and trainings. We do content, our blog, more video content. We're just educating, right? And so however that happens doesn't necessarily matter. If you work better watching a video versus somebody else talking to one-on-one, that's great. But what we recognize is that the doctor can't be the one hand-holding somebody through these questions day in and day out. We need that next layer of support. And you've seen Duke University launch a health coaching training program. You've seen City Health Works launch community health worker programs. It's really become recognized across healthcare, not just in this kind of medicine, that we need a team-based approach. It can't just be like a doctor, whether you're handing out a stack of prescriptions or you're like us handing out a new plan for life, you can't just hand it and then expect someone to like instantaneously integrate it. So you need that support.